Bob Blackman.
Thank you very much, Mr. Deputy Speaker. And I would like to start by paying tribute to the NHS staff and the care workers who've gone above and beyond the call of duty to care for people who've been suffering from this dreadful virus. Also, for all those that have been involved in setting up testing centres and the new vaccination centres. They once again have had to work incredible hours over the festive period to actually make our lives more tolerable and to enable people to be tested and to be vaccinated. But the situation in London tonight is at a critical stage. The report suggests that London capacity in hospitals is at 99.7%, which doesn't leave any room for any people that are suffering from COVID and being transported to hospitals. Equally, the new variant appears to be causing this huge rise in the transmission rate. And the last data showed that in London, every London borough was experiencing an increase in the transmission rate across the board. And certainly my own borough was sitting at the last public data at 632 per 100,000 tests. Yet tonight, the report is that it's a 792, a dramatic increase once again. Now, all of the boroughs across London are experiencing these problems, and indeed testing is definitely the answer. But there is a confusing message, and I would ask my honourable friend on the front bench when she responds to this debate to make sure that people understand the process by which they should go for a test. By definition, if we've got walk-in centres, some people are walking in thinking that's all they have to do to get a test. Some people are walking in thinking that's all they have to do to get a test and not actually phoning ahead to book a test or indeed even going onto websites. In some cases, people are literally walking in and getting a test where others are being turned away. I would also be concerned about the position over the vaccine centres. The reality is that if we've now advised people that one jab will be sufficient and wait 12 weeks for the next jab, we are going to lead potentially to a source of confusion. One of the problems that we are going to experience is that people can still carry COVID-19 and infect others even after they've actually had a vaccine. And we need to be clear that this is the position so that people don't inadvertently go out and cause further infections and transmissions. There is also another issue, which is where on the priority list for vaccinations will learning disabled people be? It appears to be that they're just on the age range, but in many cases, learning disabled people need to be assisted by a carer and need to be taken to a centre for a vaccine. They're not necessarily able to do this by themselves. We also have to take into account the economic impact of this dreadful virus. We've heard about the hospitality industry, but there are many people who've received no help from the government whatsoever. They changed jobs just at the wrong time. They were self-employed and couldn't produce accounts. We could go through the list. And those people desperately need assistance. In my own borough, unemployment has doubled since the pandemic began. We had virtual full employment, so we were in a position whereby we could cope with that. But in many other parts of the country, that's not been the case. Finally, Mr. Deputy Speaker, I want to talk about the position over the vaccine rates. The reality is if we vaccinate 1 million people a week, it will take us 14 months to actually vaccinate the whole population. If we can do 2 million, we reduce it to 7 months. That's still far too long. And there will be people out there that resist having the vaccine. We've got to promote this vaccine and promote people having it as quickly as possible so that we can get back to as near a normal as we possibly can by Easter and beyond. Then we can make sure that the economy bounces back and people are safe. So finally, Mr. Deputy Speaker, I would ask my honourable friend on the front bench when she does respond, the whole of London is in tier 4 right now. The position is confusing in Harrow because we appear to be in a position whereby all the primary schools in the surrounding boroughs will be closed from next Monday, but in Harrow, they'll be open. That seems to be confusing to everyone when we're in the same position as every London borough.